Hello, welcome to Anatomy DAHAR series. I am Dr. Abdul Hamid. Today's topic is frontal and ethmoidal sinuses. Free medical education. The paranasal sinuses. They are air-containing cavities in the bones around the nose. There are 4 pairs altogether, 4 in number on each side of the skull. This is anterior view of the skull. This is left lateral view of the skull. We have 4 pairs of paranasal sinuses. This is frontal sinuses, which are high up in the frontal bone. And next is sphenoidal sinuses. It is in the body of the sphenoid, far deep inside. Next is ethmoidal sinuses. They are in the lateral mass of the ethmoid bone. On each side, 3 groups of air cells, anterior, middle, and posterior. And finally, the maxillary sinus, which is the lowest but the biggest in the body of the maxilla. So if you see from lateral side, this is the frontal sinus high up in the frontal bone. This is the sphenoidal sinus far back in the body of the sphenoid. Ethmoidal sinuses, 3 groups on each side, anterior, middle, and posterior. And maxillary sinus, the lowest but the biggest and most clinically important inside the body of the maxilla. Frontal sinuses. We are looking the skull from anterior. This is frontal bone. This is orbital cavity. This is orbital margin. This part is upper part of the orbital margin called supraorbital margin. Now we are going to talk about frontal sinuses. Frontal sinuses are triangular shaped flat paranasal sinuses located in the frontal bone above and deep to the medial part of the supraorbital margin. It is irregular pyramidal in shape. The frontal sinuses are often asymmetric. The septum between the 2 sinuses is seldom in the middle, occasionally incomplete or deficient. Therefore, the size and shape of the sinuses is very irregular, unequal. One or both sinuses are occasionally absent. The vertical extent varies from 24.3 to 66 mm. The duct of the frontal sinus, frontonasal duct, commonly opens into the ethmoidal infundibulum in the middle meatus. We are going to talk about this one later. This is the superior view of anterior cranial fossa. Frontal sinuses are deep to it. Now we are going to talk about the width and depth of the frontal sinuses. Average width of the frontal sinus is about 70 mm and average depth is about 10 mm. But when enlarged, it may reach up to 49 mm the wide, and the depth may be up to 46.5 mm. Frontal sinuses are located between the outer and inner tables of the frontal bone. Frontal bone has 2 tables, outer and inner. In between is frontal sinus. Variations of the upper attachment of the uncinate process. We have 3 diagrams here. All are coronal sections of the left nasal cavity together with left frontal sinuses and left maxillary sinuses. This is inferior turbinate and this is middle turbinate. In all cases, as we know, uncinate processes are attached from the inferior turbinate inferiorly, but superiorly they have variations. A. If uncinate process coming from inferior turbinate attached to the lamina papyracea on the lateral wall, the drainage from the frontal sinus will come medial to the uncinate process directly into the middle meatus, that is in 50%. But in B and C, the uncinate process coming from the inferior turbinate in B goes up and attached to the skull base, or goes up and attached to the middle turbinate, then drainage from the frontal sinus, here in this 10%, will come down lateral to the uncinate process. Here also come down in 40% lateral to the uncinate process, together with drainage from the maxillary sinuses. We are showing the ethmoid bones. It is centrally located bones in the skull, connected or joined to many bones around it. It is very important bone. This is called crista galli, a thick triangular process at the anterior part along the midline of the ethmoid bone. On either side of crista galli is perforated plate called cribriform plate. Above the cribriform plate is anterior cranial fossa. On the cribriform plates lie olfactory bulb, parts of the first cranial nerve, olfactory nerve. This is lateral mass of ethmoid bone, in which we have three groups of ethmoidal air cells: anterior group, middle group, and posterior group. This is downwards extension of the crista galli, called perpendicular plate of the ethmoid bone. It forms the median nasal septum, upper part of the median nasal septum. We see later. Ethmoidal sinuses. Ethmoidal air sinuses are clusters of thin-walled, honeycombed air cells in the lateral masses of the ethmoid bone. They are also known as labyrinth, a system of intercommunicating cavities. They are arranged in three main groups: anterior, middle, and posterior group of air cells, separated by septa. This is anterior group, this is middle group, and this is posterior group inside the lateral mass of the ethmoid bone. Anterior group consists of about 11 air cells. Middle group consists of about 1 to 3 air cells, and posterior group consists about 1 to 7 air cells. Enlarged ethmoidal sinuses. When ethmoidal sinuses become enlarged, they extend and invade into the neighboring structures. First, superiorly, they will invade to frontal bone and anterior cranial fossa. Second, inferiorly, they will invade into the maxillary bone. Third, anteriorly into the lacrimal bone. Fourth, posteriorly into the palatine and sphenoidal bones, posteriorly. Fifth, medially into the nasal cavity. Sixth, laterally into the orbital cavity through a thin paper-like layer called lamina papyracea. AGGER NASI cells. AGGER means mont or eminence. NASI means nose. AGGER NASI means mont in the nose. When it is pneumatized, that means contains air, they are called AGGER NASI cells. They are most constant anterior ethmoidal cells, found in about 98.6%. That's why this topic is included under ethmoidal air sinuses. Let's see, this is the inner surface of right lateral nasal wall. This is superior turbinate. This is middle turbinate. This is inferior turbinate. This is frontonasal duct. This is ethmoidal infundibulum. The green color is uncinate process. This is lacrimal bone. This is frontal process of the maxilla. This area is called atrial, the entrance. Now let's talk about AGGER-NASI cells. They are located always at the anterior edge of the middle turbinate, on the lateral wall of the nose, at the upper part of the atria, always in front there. They have pathological role in obstruction of frontal nasal duct. The relations of AGGER-NASI cells are laterally is the lacrimal bone, superiorly frontonasal duct and frontal sinus, anteriorly the frontal process of the maxilla, this is the one, medially uncinate process, the green color, and posteriorly infundibulum, this is the one. Let's see the diagram in these slides. This is the mid-sagittal view of the body of the sphenoid. This is the body of the sphenoid below the pituitary fossa. It is occupied by sphenoidal sinus. This is optic nerve. Onody cells. Onody cells are posterior most air cells of the posterior ethmoidal sinus. They are located within the body of the sphenoid. This is Onody cells located in the body of the sphenoid. In X-ray of the body of the sphenoid bone, if two cavities exist above and below with the transverse septum DS between them, the cavity above is Onody cells. It is separated from the sphenoidal sinus below it. Clinically, what is important is in about 11.7%, the optic nerve passes through the Onody cells, which has dehiscence. Take note and care that internal carotid artery and central artery of retina may also be enclosed in the Onody cells. So it is dangerous during sphenoidal sinus surgery. OSTIA, openings of frontal and ethmoidal paranasal sinuses. Let's see the diagram. This is the inner surface of right lateral wall of the nose. This is anterior. This is superior turbinate. This is attachment of the middle turbinate. The space below the superior turbinate is superior meatus. The space or passage below the middle turbinate is middle meatus. In the middle meatus, you will see prominent, bony prominent. This is ethmoidal bulla. Underneath the ethmoidal bulla is the hiatus semilunaris. Anteriorly, hiatus semilunaris is connected to the ethmoidal infundibulum. This is frontal sinus. Let's talk about the opening of frontal sinus and ethmoidal sinuses. Frontal sinus opens into the frontonasal duct, which opened into the ethmoidal infundibulum. Ethmoidal infundibulum again opened to the anterior end of the hiatus semilunaris. So frontal sinus opening is here at the anterior end of hiatus semilunaris. Next, we are going to talk about the openings of the ethmoidal sinus. Ethmoidal sinuses consist of three groups: anterior, middle and posterior ethmoidal sinuses. Anterior ethmoidal sinuses opening or ostium of the anterior ethmoidal sinus is at the anterior part of hiatus semilunnaris. This is the one. Anterior part of hiatus semilunnaris is where the anterior ethmoidal sinus opens. So this is the anterior ethmoidal ostium. Next is middle ethmoidal ostium. That is the middle ethmoidal sinuses opening. This will open to the ethmoidal bulla or above the ethmoidal bulla. That is in the middle meatus. So this is middle ethmoidal sinus opening. And posterior ethmoidal sinus opening, posterior ethmoidal ostium is posterior part of the superior meatus, just underneath the superior turbinate. The end, illustrated and presented by Dr. Abdul Hamid Abdul Rashid. Free medical education. See Anatomy DAHAR series, Paranasal sinuses, blood and nerve supply, embryology and functions. For the benefit of future users, the author welcomes short comments and suggestions from the readers. Thank you.